Welcome to H&HN Daily. I'm Susanna Hopsalerin, Senior Editor for Hospitals and Health Networks magazine. According to the General Accounting Office, 8.2% of critical access hospitals and 12.2% of rural hospitals achieved meaningful use in 2011. The Office of the National Coordinator has set a stretch goal that 60% or 1,000 of the nation's critical access and rural hospitals implement and meaningfully use EHRs by 2014. Faith Community Hospital in Jacksboro, Texas, got the board involved and met meaningful use Stage 1 requirements. Today, I'm joined by Frank Beaman, CEO of Faith Community Hospital in Jacksboro, Texas, to discuss the trustee's role in the move to health information technology. Welcome, Frank.
Thank you. Good to be here, Steve.
Thanks for joining me today.
Pleasure.
What's the board's role in the implementation of the EHR?
Well, the board's role in the beginning was to just understand it. You know, the board sees a significant investment being made in really an unknown technology. As we all know, that the systems are unproven, although moving in the right direction. But the concept is hard to get a lay board to understand. So initially, the board needs to get an understanding and then to get behind the efforts once they have a grasp of what's going to take place to support the CEO for implementation.
Did you have skeptics or did you have champions on your board for this project?
Well, that's a great question. And you know, a lot of times skepticism can be cured by one or two champions and or dollars. You know, and when the carrot of the stimulus money that's attached to successfully attesting, a lot of skepticism can go away. But in my case, I had some champions, and they came about in board members that were over 70 years old. In fact, one of my dear champions is an 80-year-old board member, and she just embraced the technology. And basically, when we said, look, achieving meaningful use and attesting on a timely basis as we set forth is not an option. This is not a passing fad. This isn't something that's going to go away in a couple of years. But when we had the example of an 80-year-old using an iPad, getting involved with the attitude of there's no excuse for not participating and not jumping on board, it was quite easy, actually, at that point.
This is a massive undertaking for an organization. How did you get the board up to speed and keep them informed?
Well, one of the things that it's imperative, again, you've got a significant investment in a system like this. It could be $1 million, $2 million, depending on the size of your facility. Early education is key, and letting the board know, you know, again, conceptually, what is this going to do for us? And then carrying it through. We in particular decided to do an education program every month with our board, whether it was good information or bad information, from the standpoint of, were we successful? Oh gosh, did we run into a stumbling block? We let the board know. And what that did is it empowered the board in a way to say, hey, yeah, we know what our hospital's doing. And then when they would hear somebody maybe in the community, because somebody in-house had grumbled about the process, they said, yeah, we know about that. So I would say the most important thing that we did was educate the board and do it frequently and get them up to speed.
What advice can you give to CEOs on keeping the board and staff engaged and to overcome resistance that's natural?
Well, let me address the resistance first, because I think resistance is going to happen. And you are going to find employees that just flat refuse to get it. And I'm not talking about the employees who need extra education or that you need to encourage a little more, or maybe it's a little scary for them. I'm talking about the employees that just willfully will not participate. You need to get rid of them. You need to flat have a cleaning of the house if you're not going to have people willing to do this. You have to have your board support, and your board has to know that this is the process that you're going to go through. And if you find the resistance, that you're going to take care of it and then encourage. Now, one of the things that we did was we made our board electronic. By converting to iPad board meetings. That was probably one of the biggest examples that we could give to the entire staff, because the board, again, I have 3 board members over 70 years old. If they can do it, there's no reason why anybody else can.
Jacksboro is the birthplace of the 4-H. If you were to receive a blue ribbon for this project, what would it be for?
This was about an organizational culture that was successful because we came together, we encouraged one another, and we gave examples and then stuck together through the hard times. So perseverance, I think, is the pretty good blue ribbon that I'd hand out to everybody.
Thanks for joining us today.
My pleasure.